Who really decides on your medical choices? When you walk into a doctor's office, it feels like your health is in your own hands. But what if the choices in front of you were already made by someone else years earlier, long before you entered the doctor's surgery, before you had problems, by people in drug companies, politicians, and a system that quietly decides what counts as healthy and what doesn't? So let's look at the power of medicine. Medicine isn't just about treating illness. It's about deciding and defining what is illness. A restless child becomes ADHD. Feeling down after a breakup becomes depression. Aging a skin becomes a condition that needs treatment, anti-aging. It isn't just about science, it's about power and a process called medicalisation, where everyday experiences and challenges become turned into medical problems that need medical treatments and drugs and tests and procedures. Big Pharma obviously plays a role. Once something is medicalised, there's money to be made. So Big Pharma has a role. Pharmaceutical companies. Pharmaceutical companies don't just make drugs, they fund research. They sponsor medical conferences. They lobby politicians. They pay for medical training of doctors, influencing the way they think about disease and treatments. And the result is that evidence that guides your doctor's opinion is often shaped by corporate money, profit, neoliberalism. Take the opioid crisis. Pain was rebranded as the fifth vital sign in the early 90s, a move pushed by pharmaceutical marketing. Prescriptions skyrocketed, addiction followed, and thousands of lives were lost. That wasn't just a medical mistake. It was a profit-driven science turned into policy that made doctors feel pressure to prescribe more and more painkillers, and despite the addiction and the harm that was done. Medicine is political. We like to imagine science as neutral, but it's not neutral. Politicians decide what research gets funded. Regulators approve which drugs reach the market, and corporations, big companies, shape the guidelines that doctors use. By the time you sit across from your doctor, your choices have already been narrowed down by politics and profit. Just look around your doctor's surgery and see the branded pencils, paper, mouse pads. It's embedded in their system. This isn't abstract for patients. It looks simply like a doctor prescribing a drug that was covered by insurance. Not necessarily the best one for the patient or the best treatment. Sending someone for a scan or a blood test that's not even needed. Yes, it gives information, but it's part of the whole system, rewarding each other to be part of the system. So being sick isn't just a subjective experience, it's a marketing opportunity. The criteria, the diagnostic criteria, the lens through which doctors perceive your illness, where do they slot your symptoms onto a shelf or out of a book so that they can sell a treatment, make a profit. Unfortunately, this is a big aspect of medicine. I'd like to know what you think. Let me know in the comments if this is your experience, or maybe it's different, but this is just a perspective that medicine is political, medicine is power, and politics and medicine is a very important subject. But it's very important to put on your critical thinking, your questioning hat, and to ask questions. Does science really say that this works? Or is it something to do with who funded the research, who funded the science? What's the government's focus in health? European focus, global focus. Who profits from certain definitions of health? This has got evidence, this doesn't have evidence. According to science, there's very little evidence for herbal medicine. Yet I know, and you know, that that's not true. And whose voices are missing from the decision-making process? Well, the patient is a passive consumer. It doesn't have a voice. For the most part, it's not even supposed to Google. And if it does Google or watch YouTube, it's perceived as misinformation. Anything that is not mainstreamed, that suits the establishment, the top-down hierarchy of the medical complex, is misinformation. So this is a misinformation, just telling you that there's power dynamics in relation to medicine. Politicians are involved and industry who make profit are involved. This is misinformation. But it's not a misinformation, it's information. It's misinformation because they are losing control of the narrative. They want to control the narrative so that you don't think for yourself, you just passively go along and receive whatever medications they want to give you. We become passive recipients rather than agents. Humans with agency, ability to make decisions, and what really matters to be healthy, what it means to be well, what does disease mean, what's going on in my body. So this is just a brief introduction. If you're interested in a longer topic on this subject, a longer video on this subject, let me know in the comments. And it's been a pleasure. See you in a video very soon. Take care.